Hi, and welcome to NoVA Weekend Warriors. I'm Meg Donnelly, a licensed massage therapist and mobility coach here in Herndon, Virginia. We're focused on athletes of all abilities and bringing you the latest in everything that's going on here in Herndon and the surrounding area in health, wellness, and fitness. And today I am very excited because we have a name that I think a lot of people in the area know, and that is Calvert Rejuvenations, which originally started as a spa and now is offering acupuncture through doctors of acupuncture, Dr. Calvert and Dr. Ruby. Can you tell us a little bit about Calvert Rejuvenations?
Calvert Rejuvenations, I founded Calvert Rejuvenations in 2006, and we are really all things skin and body. We don't do hair, we don't do nails, but manual lymphatic drainage, myofascial release, sports massage, master estheticians. Our whole skincare staff is master estheticians, and now we have the pleasure of having a dedicated acupuncture clinic just above the main area of the spa where we've been for now about 18 years.
Wonderful.
Yeah.
And so today we're going to focus on that acupuncture clinic, and I'm really excited. And off camera, Dr. Ruby and I were talking about the schooling. And it's quite an extensive amount of schooling that you all have gone through.
Calvert and I were recently certified in supportive oncology acupuncture through Memorial Sloan Kettering Hospital in New York City. And we have been very thoroughly trained in acting as part of a patient's care team when they're going through cancer, both during the treatment as well as after the treatment.
This is really exciting to me because one of kind of my mottos is let's guide by the side, right? And then also let's work collaboratively with a healthcare community. So often we end up working in silos, right? We do something and then and I just think about when I had a family member who was in the hospital and the heart doctor said, all right, we got to go in for surgery. And I was like, wait, the kidney doctor just told me we're going into kidney failure. So maybe we don't need to do heart surgery, right? And so having kind of a collaborative effort, I think is really important and something that's kind of celebrates the whole person's journey. And I know off camera, we were talking a little bit about kind of how you do that. And sometimes it's not so easy, right? And so can you tell us a little bit about how you kind of ensure that you're working collaboratively?
Calvert and I have both been trained in how to communicate with doctors, respectively, not only doctors, but also physical therapists, mental health therapists.
Just how to really cultivate a care team so that we can, cancer patients not only, I think, need and would benefit from acupuncture care, but frankly, I think, and this goes for patients of all kinds, but they deserve a supportive team that has lots of different members from lots of different silos to make sure that we're looking at all aspects of their health so that whether they're about to begin treatment, they're in the middle of treatment, or they're doing that big life step down into like outside of such an acute care situation, everybody deserves to have all aspects of their health really taken care of. And the only way that we can do it is in a community of caregivers. And so that was a significant part of our training, was how to cultivate that.
Yeah, and our degree is in integrative acupuncture. We have been trained to translate what we're doing in Eastern medicine into Western medical terms for the oncologist, so that we can very clearly say what we're doing and not doing. Like we know what points to avoid, we know what herbs to avoid, and then we also can read their reports. We know about the different cancer drugs. We know about the different types of radiation, and we know what symptoms to look out for ahead of time, so that if we see patients before they even begin chemotherapy, for instance, which is what studies have shown provide the best results, we are able to often prevent the symptoms that come alongside with certain cancer drugs.
Sure. And that's why, right, we're not talking about alternative, we're talking about integrative. And to those points, that is why, right? This is something that is going to enhance, not something that you're doing instead of, which I think is really important. And, sometimes, listen, I'm not always going to be able to get a doctor on the phone to talk to them about my client's care, right? But you've got some really good training in how to write information that you can give to the client that the client can then hand over to their doctors. So even when you're not directly speaking with them, their clients are actually to be able to kind of speak on your behalf and be that connecting point. Can you talk a little bit about that?
So whenever we have a patient come through the door, if they're under a doctor's care, and we always encourage them to have seen a medical physician within the last 6 months, so that if we're dealing with something that needs a diagnosis or has a diagnosis, that we, again, can initiate that relationship with their physician. So we get the physician's name, address, we send them a letter, we have a shared patient, here's our goals, these are our treatment principles. If you want us to know anything, here's how to contact me. And then we just know, and again, like as part of our training, we're really good at staying in touch with those physicians. And we may never hear from them, but occasionally we will hear from a patient, oh, I was talking with my doctor about the acupuncture and he said blah, 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 blah.
Right, exactly.
So the community is there, even if it's not just an outright communication that we're having.
Yeah, and it also gives the patient an opportunity to feel empowered within their own treatment plan,
right,
and know what's going on.
And speaking of that empowerment, one of the things that I think is really important for you all is not just the treatment itself, but in working with and listening to your patients. Can you talk to us a little bit about what that looks like for a client?
There's obviously a huge psychological component, not only for the person undergoing cancer treatment, but also for the family and their entire support system. So acupuncture and Chinese medicine as a whole, we are very much in touch with and giving the patient space to tell their story. We're asking very specific questions in order to understand what is going on for them, for their body. We could have a couple different people on the same exact cancer drugs with very, very different symptoms based on their underlying constitutional signs, based on their lives, on their life story, different things that have happened to them over time. So inherently, our medicine is very much providing a space for these people to come in and feel seen and feel heard, and then to get on a treatment plan that they can rely on during the treatment in order to make the treatment last, like in order to get them through the treatment successfully. And then it also provides them with a plan to continue after the Western part of the treatment is over so that they can transition back to life.
Yeah, that was something that kind of like really kind of hit close to my heart. Talk to me a little bit more about after the Western treatment ends and kind of, when someone is done with their cancer treatment, and kind of almost left out into the world, just like, okay, go back to normal. But you have a series of treatments to kind of help with that transition. Can you talk to us a little bit about that?
After treatment ends, not all the symptoms go away. So to just stop all manner of care, and as you said, go back into the world and back to work, enjoy your job, is just simply not practical. And you've also, I think, as a patient, have exited all eyes being on you. And so it can feel especially cold to, again, just have all of your care stop and like, okay, your oncologist, you'll see them again in 6 months for a scan. But meanwhile, you might be left with peripheral neuropathy. You might be left with dry mouth. You might be left with hot flashes, night sweats, bone pain, muscle pain. All of those things don't necessarily stop when the treatment stops. So that's something that we build into the treatment plan, and we reevaluate every visit when we do our medical evaluation and discussion with our patients.
When you talk about that, you're reevaluating constantly. So typically for you all, if there's a treatment series, like, is it locked in? Or are you saying that kind of we're making adaptations throughout that treatment? Or is it like you're either signed up for, you either sign up today for 4 weeks, 8 weeks, 16 weeks, whatever it is? How does that process work for you all?
In acupuncture, there are very few treatment protocols. Like I said, a bunch of different people could come in with the same chemo drugs, but their symptoms could be completely different. So with acupuncture, we can do kind of a lot of things at one time. Like we can stay on a treatment plan to prevent the chemo-induced peripheral neuropathy that we see a lot of times with certain colorectal chemotherapy drugs, for instance. But if they're also having random insomnia or digestive issues or whatever, we will absolutely tailor the treatment to prevent the neuropathy while also helping their little pop-up symptoms along the way.
That's right. Every time. And there are conditions where, like for orthopedic, just for example,
Sure.
it's like, okay, if you're in this level of pain with this level of reduced range of motion, typical standard frequency is going to be twice a week for 3 weeks.
Yep.
We'll reevaluate. And that's typically when we would expect to see results. But yeah, so to Ruby's point, we're tinkering and changing that treatment every single time. There are 500 acupuncture points, and we pick 10, maybe 20 of them in a particular session. And so, we'll drop one and then we'll add in another, and we change the constellation pretty much every visit.
Yeah. And when we talk about like Eastern versus like Western, or Eastern and Western, right, which is now what we're kind of coming closer to, a lot of times what people don't realize is, even though this may have started as Eastern medicine and still is as primary, there is a lot of science behind it, and there are a lot of studies behind it that are showcasing that the kind of profound effects that acupuncture can have for people going through cancer treatments.
Yeah. So I was actually just thinking about this on the way here, that there's this point here. It's used on almost every person, and you can do it for acupressure at home. It's considered the universal pain point. And the reason, one, Chinese have been studying acupuncture for literally thousands of years, and it was their primary form of medicine for about that long. But during functional MRIs, when the person is awake and moving, with stimulation of this point, they've actually shown a deregulation of the limbic system, which is where all of our pain signals are coming from. So we have all kinds of studies like that now. We know that this point actually can increase the salivary gland activity. So for oncology patients who have dry mouth. And so, we have lots of ways of testing things now, not just anecdotal.
And it's a really good time to be getting this certification for us, because now we have almost 4 decades of very robust randomized clinical control trials, systematic reviews by the Cochrane Institute, some of which have been led by Memorial Sloan Kettering Hospital, showing the literal benefits of including acupuncture in an oncology overall treatment.
Yeah. And we see even here locally, like our hospitals are really embracing doctors of acupuncture coming in and working with their clients and kind of creating that more integrative care. So it's an exciting time to see that. And to see, it's really sad that for a while when we talked about Eastern medicine, it was almost like we were talking about something else. And to me, it was like always so weird. It's like, why was Western better and Eastern, looked at in a different light? And so to see now the understanding of the cultural things that we've learned, right? Maybe we didn't have a study that showed that this exact point came to XYZ, right? Or was attached to the limbic system or whatever.
Right.
But what we did know is culturally through generations that when we kind of hit that point, right? And how many people have done that? I've done that, right?
When you have a headache, you push,
yes,
this is an acupuncture point.
Exactly.
It's like human instinct.
And we know it makes you feel better. Yeah. So it's nice to see that kind of come together for sure.
That validation is nice, being able to see the study. But one way, and I'm a Western girl. So it's when I was going through acupuncture school, it really became very clear, and this might be a little bit of shift for some people, is all that is a translation of what Chinese medicine has known for thousands of years into Western terms.
Yes.
That's all that it is.
Yeah.
Yes, it's a validation for our brains, but it has always been true.
Always been true, right? It's
so,
just putting new terminology for it for us to understand that.
Right.
So I want to shift gears a little bit. Well, maybe not so much, but when we think of acupuncture, one of the things we think of immediately, right, is needles. Can you talk to me a little bit about like the difference between acupuncture and dry needling? Like, where does it come together? Where does it kind of spread apart? Can you help us with a little explainer of that?
The first point I would like to make is that dry needling is acupuncture. It has always been acupuncture. People who are dry needling now, chiropractors now physical therapists, they're using acupuncture needles. They're using the same sharps containers that we're using. It's
acupuncture techniques.
It's acupuncture. With acupuncture, Calvert already mentioned, we have almost 500 acupuncture points, and those are just on the primary channels themselves. Then we have a lot of other acupuncture points. But under the umbrella of acupuncture is also dry needling, which is just going into the musculature. So we have to have a very strong understanding of the anatomy, which we do. We've taken countless classes. And basically dry needling, it's not always on the acupuncture meridians that we've studied, but they often are because the acupuncture meridians fall on fascia where the musculature also falls along. But with dry needling, we are just going into the motor point of the muscle itself. So take the upper trap, for instance. The motor point of the upper trap is right in the center. We isolate the muscle. We go and tap the nerve bundle that controls that muscle, and we disinhibit the connection between the brain and the muscle. So a lot of people have tight upper traps. I know I do. We either hold our stress in our shoulders or in our pelvic area. So for those of us holding it in our shoulders, you can go in, isolate the upper trap, tap the motor point, and when patients come in, they're sitting like
Shoulders
this.
in love with their ears.
Yes. And then we tap the motor point and patients on the table immediately feel the, because we're disinhibiting this tight, contracted connection, and then we're neuromodulating by then massaging it out, sometimes doing cupping, sometimes doing gua sha or e-stim to maintain that
The new connection,
that
the relationship.
That relaxation. And then what sets an acupuncturist apart from doing dry needling from a physical therapist or a chiropractor is that we also, Calvert and I both, before we do any type of dry needling, we are always calming the nervous system by doing ear points that immediately access the vagus nerve. We often use something called the NoVA protocol, which was popularized by the VA to help get people out of shock.
Okay.
So it works really, really fast. So we usually start dry needling sessions with ear points so that it's not as painful, and also so that the musculature can relax in a more sustained way.
Sure. So it's kind of similar to how, right? My theory for a massage is like, it doesn't have to hurt to work, and you don't go in there with an elbow immediately, right? You kind of got to calm the nervous system down and then do things kind of like sometimes in sets of 3, because we have to like get the body used to and comfortable with the movement, comfortable with things. And then once things are calmer, it's easier for you to work, easier for people to receive the work, and then easier to move on. And that brings me to another great point. And that is, a lot of times when people are going through treatment, exactly like I'll have a lot of people that come into my studio and they'll tell me how, well, I only had 5 minutes to kind of say what I needed to say before I was going into treatment, or I was only able to meet with my doctor for 5 minutes. And I find sometimes that people haven't been able to really share the full encompassment. I don't know what the word is, but they haven't been able to share their full story of what's going on with them right now in their cancer treatment. But your sessions, because of the amount of time that you're with someone, really allows for that. Can you talk to us a little bit about that?
We ask so many questions when people come in. And it's not so much, what's really interesting, because sometimes people either can't articulate, don't want to articulate, or from any number of reasons, articulating their story might be difficult. While we give them plenty of opportunity, and we need the words that we choose are very important and actually help guide our treatment. If someone says like, I just feel so overwhelmed, I can't make a decision, we're like, okay, cool, gallbladder channel. And so we know like where that resides in the physiology, but we also look at people's tongues. The tongues tell us so much about what's going on deep in the body. It's the only internal organ that we can look at without cutting you open. And so it tells us a whole lot. We listen to the pulses on both sides at different depths. It tells us what's going on with the fluids, the blood, is the heart communicating with the kidneys and vice versa. So it's the story is really important, but I think we also want to not encourage people to get too lost in the story, because we're coming through. That's really what this is about, is supporting people through and into a next, robust and vibrant phase of life. And so we get to, the body will tell us what to do, and the words that we choose are also important, but it's a full encompassed consultation that they get every time that they're with us.
Beautiful.
Yeah.
And that really speaks to me, that you're talking about like helping someone throughout their life, right?
Yeah.
We're not just isolating them, and they're not just their current treatment, right?
They're not the diagnosis.
Exactly.
Yeah.
Not their diagnosis.
Yeah.
So I love that.
Yeah.
Yeah. Tell me a little bit about some things that we haven't touched on yet so far that you would like to make sure that, our audience gets to hear about and gets to explore.
One of the things that surprised me, certainly, when I finished my bachelor's degree and was like, oh, you know what? I was a massage therapist for 20 years. I think acupuncture is where it's at. It encompasses everything that I've been building my career around, whatever, to discover that it is, in fact, a 4-year master's degree. And that many of us who've become doctors, we're 5-6 years into our training program. We have to pass 3, sometimes 4 board exams. I think the rigor of the education that's required to become an acupuncture physician or a doctor of acupuncture is intense. And that was certainly a surprise to me. And so I know a lot of people will probably also be surprised by that.
Yeah, absolutely. Well, you earned that doctor of acupuncture title for sure. What I'd love to hear about is who is an ideal client or patient for you?
In terms of oncology, again, studies show that if you start acupuncture before cancer treatment, the symptoms are less, and we can also, like we said, anticipate them to prevent them. So anyone who is about to start chemotherapy, radiation, any of that, obviously somebody who is in active treatment, and then anybody who is trying to transition out of a very strict Western treatment plan and trying to stay on some type of train that's moving in a positive direction.
For whole body health.
Yeah. Also for caregivers who are also dealing with the psychological weight of someone in their family undergoing cancer treatment. It's something that affects, I think, 1 in 4 people in this country. And there's a lot of stress and fear around the word cancer, even though there are so many incredible treatments coming out. That was one of the unexpected things that I learned during our certification was how incredible chemotherapy and radiation and gene therapy has become over time for the world of cancer. Not only for fighting cancer, but also just living with cancer.
Yeah.
It's no longer a death sentence.
Yeah.
But again, it can still be extremely stressful for caregivers and family members. So I often treat the person who is going through the treatment as well as their partners, their kids. So pretty much anybody.
Yeah. No, I think that's a really good point and something that we forget about, especially because my generation we're called the sandwich generation now, right? Because we are kind of sometimes taking care of parents and taking care of kids. And as a woman, unfortunately, caretaking roles really do kind of get laid upon us, I think, at a much higher level than they do for our gentlemen to the side. So it's definitely we could do. And I know for the people in my life who had acupuncture, just talking about the immense amount of release and relaxation that it can take. And gosh, if I could change one thing in the world, it would be how important that word relaxation is, especially in my industry and especially with sports massage, right? Mm-hmm. It was always oh, well, that's just relaxation massage. And I was no, that's the goal. It is profoundly relaxation, right? Yeah. And so we absolutely are, we are absolutely treating symptoms, right? And that's a very big deal. And that's really important. But can we treat those and have relaxation as well? And the answer is yes.
And sometimes you can't get the symptoms to relieve unless you do have a relaxed nervous system.
Absolutely.
When someone's been in chronic pain for a long time, your body will actually lay down what they call C fibers, and they're known as chronic pain fibers. So we will go in with a needle and actually break up that sort of just junk tissue. And that's literally the only way to get out of that pain and to get the pain signaling to stop. And that can only happen with a relaxed, balanced nervous system.
Yeah.
So,
yeah. Love that. Yeah. Love that so much. All right. So now that we all know that we are ready for acupuncture, and also, I know we specifically today, we're talking about our clients and your patients that are dealing with a cancer diagnosis. And one of the things that I do say as well in my studio is it's not a matter of if you're going to see someone who has been affected by cancer, it's when, right? And so I appreciate everything that you're doing. I appreciate what you're bringing to our community. I, for one, am very big on collaboration and over competition. And, to be able to support within our community an acupuncture clinic that is really kind of, I think, laser focused on their clients and their patients means the world to me. So thank you so much for being here. If people are ready for this journey,
Yes.
how do they find you? Where can we go? How can we learn more and book a session?
Well, we're on Instagram. We're on TikTok. Thank you, Ruby. CalvertRejuvenations.com is the website where you can read all of our blogs and see our videos and book online. And you can also verify insurance because we are in network with Blue Cross Blue Shield Care First.
Awesome.
Yeah.
All right, beautiful. Well, thank you so much for being here with us today.
Thank you so much.
Absolutely. And as a teaser for everyone, I think we have perhaps maybe a little mini series of sorts coming up where you're going to dive into a couple other issues within or other conditions that people can work with acupuncture for. Is that correct?
Yeah.
All right. So I am so looking forward to that as well.
It'll be great fun.
All right. Thanks again.
Thank you so much.
My pleasure.